So at the day of the surgery, you extract the teeth, and then you see you have a surgical guide ready to go. Now it's very easy. This is a pilot drilling on the situation again. So here we go. We have extract the teeth, and then we are place our implants. Now, as you can see in the picture, now the implants are placed according to your prosthodontic position and according to what you plan. And now you're just going to fill the voids between the micro gaps, and you're going to fill the pontics, so you create the best prosthodontic position. Now, the lab technician is already prepared with a provisional restoration. But this time is not directly on the implants, but on the multi-unit abutments. So you place your interface, and then you're just going to rebase this situation, because I told you that is a pilot drilling, it's not a fully guided situation. So, but as you can see, you're very close to the final product. It's very different if you have to open and place your provisional cylinders and cut the cylinders and then unite everything with powder and liquid. Now I have a situation where you're very close to final situation. You just have now rebased the acrylic to the interface, and then you're ready to go with small adjustments. Of course, this is something that we did, and you can see at the day of the surgery we already start to create a situation where we're going to prepare the pontics for the patient. Now this is the healing after 1 week. You see some biowasp particles coming out the pontics, but you can see that you're starting to build a natural soft tissue contour. It is perfect? Of course not. Of course it's not perfect, and it's very different from one side to the other. But don't forget that on the left side you have teeth, periodontal apparatus, supracrestal fibers, but on the right side you have pontics, implants, and all those stuff that will make a peri-implant apparatus very difficult to sustain and very difficult to mimic from the other side. But even though I think we have a very fair situation, of course everything is provisional. Now we try to set only the soft tissue portion, then everything will be corrected with final restorations. But you can see that the soft tissue profile is starting to mold to your provisional restorations. So after a couple of weeks, we see that we have a nice sculpture of the final restorations. Of course, there's pigmentation, the glaze from the characterization is coming out. So aesthetically, it's still a mess. But what I wanted to look is on the soft tissue profile. The soft tissue profile is one of the things that I wanted to point out in this case, that you can start to create a very nice pontic for your restorative dentist to finish the work. Now, when we look from the beginning, from the first situation to the second situation, there are a couple of features that I want you to see. See the papilla between the central incisors and the lateral incisors only by doing socket preservations and provisional soft tissue contours. They're coming down to a level where it would be a fair result, not a perfect situation by far, but a fair result, a result that almost mimics the left side, and especially it delays the full mouth rehabilitation for the patient, which is very important at this time. So you have the left side and the right side, and you see the implants with the provisional restoration. Now, when the prosthodontist receive this case and take out the final restoration, then we can see that we have a fair, stable soft tissue contour. So now it's very easy for the prosthodontist. It just has to do a digital impression and then mimic our work with the provisionals. But the thing that I wanted to point it out with this daily case is not an aesthetic blow-up mind cases, because of course it's an ugly case from an aesthetic point of view. But I wanted to point it out that you can start to plan on the soft tissue profile. Listen, this is only have provisional restorations and xenograft for the pontics and for the microgaps. This has no fancy stuff like partial extraction techniques. No, it's about soft tissue profiling and treatment plan thinking and CAD/CAM executing.